Welcome to Going Antiviral, the podcast for the IAS-USA, a professional continuing medical education organization focused on HIV and other viral diseases. I'm Dr. Michael Saag, professor of medicine and infectious diseases at the University of Alabama at Birmingham and volunteer member of the IAS-USA Board of Directors. Welcome to the Going Antiviral podcast. Today, February 25th, 2025, we are speaking to Dr. Diane Havlir, professor of medicine at the University of California, San Francisco. Her research focus is the treatment and prevention of HIV and its co-infections, including tuberculosis. Dr. Havlir co-leads a long-standing multidisciplinary UCSF Macquarie University research collaboration in Uganda, focusing on integrated population-level approaches to HIV, TB, and non-communicable diseases in Uganda and in Kenya. She is also co-founder of San Francisco's Getting to Zero Consortium. Dr. Havlir is currently serving as chair of the Scientific Program Committee for the 2025 Conference on Retroviruses and Opportunistic Infections, also known as CROI. Today, Dr. Havlir joins us to provide a preview of CROI 2025. Diane, welcome to the podcast.
Oh, thanks, Mike. I'm so happy to be here and very happy to talk about CROI 2025.
Yeah. So CROI has been going along since the early 1990s, and maybe you can give us a brief overview of the history of the meeting.
Yeah, sure. Well, CROI started actually over 30 years ago in 1993 to fill a gap of an ever-evolving global pandemic of our times, HIV. And the gap was there was no venue to bring together laboratory, clinical, and public health scientists. And so CROI was established. It's a purely scientific meeting. And its goal really is to advance prevention, treatment, and care of HIV. And, it's evolved over time to other viral infections and complications of HIV disease.
Yeah, I remember the very first CROI meeting and those that followed, and it had an energy around it. I know that NIH was a part of it, the NIAID in particular, working with a number of leading researchers in basic science and clinical science, as you mentioned. But what I really remember most about it was how joyful it was from the very get-go, that people would come together. I loved watching the basic scientists go to the clinical sessions and the clinical folks go into the basic science. And this cross-fertilization of ideas, I think, really helped catalyze a lot of the scientific advances that we saw, especially in the 90s. But it continues today, right?
Absolutely. And, when I think of CROI, and I also was there from the very beginning, it brings everybody together that loves science, really wants to help people and get us to ending HIV as a public health threat. But it's like an idea generating incubator. And I always think about this. It's like a backpack that's full of information, full of data. You can carry it with you. You get all these new ideas for your research and propel science forward. And in fact, we have a backpack at CROI we do every year. And I promise this year, oh, there you have it. It is not going to disappoint.
Yeah, well, that's one thing everybody looks forward to. And I remember years ago, they were taking pictures of people carrying their backpack in different parts of the world and then posting them at the meeting. But one of the other things that I think is really exciting about CROI and different is really the de-emphasis of the commercial side of HIV. It's not that commercial or pharmaceutical companies are bad or evil. In fact, they do great things for us in terms of getting medicines to people. But the scientists from the pharma companies and others are certainly a key player and participants in the meeting, but there's no exhibition hall and there's no other events. It's really the scientists getting together and meeting with each other, sharing ideas, and as you said, an incubator. I think it's really a unique conference in that way.
Yeah, I mean, I totally agree. And certainly we are partners with industry scientists. We want to get together. You know, it's through collective impact, all of us working together, that HIV really made remarkable progress. And another key component of the meeting is the community. And the community participates in this meeting in order that we can disseminate the findings of the meeting. We have scholarships for community members from all over the world. Our community members, they participate in the organizing committee, and our goal is to ensure that we are all working together, and the information coming out of the meeting is reaching both scientific community and the community at large.
I'm really glad you mentioned that because that is a key part. And in fact, the community input going back to the late 80s or mid 80s was instrumental in sparking a lot of the energy and ideas that moved forward into what we called then the heart revolution that converted HIV from a almost certain death sentence to a chronic manageable condition where people, I have, sure like you do, patients that I've been taking care of for 35, 40 years who are now in their 70s, sometimes their 80s. And that's just a remarkable transformation that I think CROI was a major part of and the community input. So let's segue over to this year's meeting, 2025. Before we get into the details of what's being presented, I think a lot of folks would want to know how the sausage is made. How do people, how does this meeting come together? Maybe because you've been on the inside, you've been leading this meeting. Maybe you could review for us a little bit of the process of how abstracts are solicited, invited speakers, et cetera.
Great, thanks for asking, Mike. The solicitation for the abstracts typically begins in the fall. It's an open solicitation, which occurs, and they're usually due around October. Those abstracts, and we get a couple thousand, are reviewed by committees in a blinded way. Okay, nobody knows, who's doing the abstracts, by people with expertise in that particular area. So we have scientists from all over the world. We put all the scores together, and then the abstracts are ranked in terms of importance, and then abstracts are selected either for oral or poster presentations. Now, we don't have unlimited capacity at CROI. We accept for presentation, either oral or poster, less than 50%. And oral abstracts are about 5 to 6% of all the abstracts submitted. So it's very competitive, but let me say the posters at CROI are phenomenal. They are very high quality. For some people, they're the favorite part of the meeting. So this is a meeting where every single presentation is of high quality science. We also accommodate late breaking scientific developments, and we have a second call for late breaking abstracts, typically right after the first of the year. And then those abstracts, a small proportion, are also added to the meeting. So we, in fact, are presenting the latest data for us to discuss and debate at CROI.
So those late breakers are usually, sometimes people submit a standard abstract at late breakers, but those typically are not accepted because they oftentimes could have, should have been submitted with the originals in October. But this is real hot news stuff right off the press. So that's very competitive. And if you get a late breaker, then I think the entire audience knows that that's going to be a special presentation of something brand new.
Absolutely. We do what we call procrastination screening. It's, if you didn't get it in on time, it's not that there's a second deadline. So, yeah. And we have those late breaker abstracts this year. We have a special session actually at noon on the last day of the meeting where we are going to be featuring a lot of those all in one session. And talk about excitement for us scientists. This is one of our favorite things to do.
It'll be standing room only, I'm sure. So, the other thing that's done at the meeting is invited speakers, plenary talks, kind of reviewing large topics that are on the cutting edge. Tell us a little bit about how those speakers are selected, those topics are selected, and what's in store for us this year.
Yeah, so those every year, as soon as we're done with 1 year of CROI, we start planning and thinking about next year's CROI. And one of the first things we do before the abstract solicitation is our program committee, which includes laboratory basic scientists, clinical scientists, and public health scientists. We meet together, we brainstorm together on what are the topics that would make most sense for plenaries, and then what are the topics that would make most sense for symposium. And a lot of times for symposium, we do areas where the data are not exactly mature, and we want to talk about, well, what do we know? What don't we know? Where do we need to go? The plenaries are really one of the highlights of the meetings. And those, what we ask the speakers to do, and we balance them between the basic scientists, the clinical scientists, and the public health scientists. We want them to be accessible to the entire audience. So us clinical scientists are getting updated on the latest in basic science. And for example, the basic scientists get update on what is happening in big public health issues.
So it really fulfills the mission of the original idea for the meeting by allowing people in different disciplines to get updated on what's happening in fields they oftentimes don't even look at until that meeting. So that's really exciting. The symposia, the plenaries, we don't have time typically for question and answer, so there's not much debate. Also, it's usually a large room and not conducive, but the symposia do have question and answer periods that I think are pretty dynamic, and people go to the microphone often and will, in a polite way, usually challenge some of the presentation. I think that's another exciting part of the meeting.
Yeah, and I think you bring up an important point of what we're always thinking of when we plan CROI. We want to make it as interactive as possible. And you know our field, people are not shy with opinions. Mm-hmm. So that's what we want to do. And sometimes, you know, we need to challenge each other in science. And that's sometimes where we all get our new ideas.
Absolutely. And let's segue back to posters. You know, it's an honor, obviously, to get any abstract accepted. And as you mentioned, only a fraction go to oral, and people feel really good when they get invited to do an oral talk. But the feedback, at least in my view, is so much more organic and dynamic at the poster sessions, because the presenter stands in front of their poster for a while and people come by, and that's where hey, I had this experiment once that went this way and it's very similar to what you saw, you might consider doing X, Y, or Z. And a lot of times those poster data are not quite in publication, so that really helps the presenter craft their messaging even better than they did for the meeting. And so that dynamic is hard to capture in any other way.
I totally agree. And, you know, our field has always been very generous. I mean, people want to see the best science in the literature. And that's what you're saying. People voluntarily give feedback that really helps all investigators, and particularly junior investigators. One of the features we added a couple of years ago is something called poster walks. And what happens in poster walks is we have some experts of the program committee where people can sign up to walk around with them, and they pick a theme and they talk with the authors of the posters, and those have been extraordinarily popular, once again facilitating high quality interaction.
Yeah, and I'm glad you mentioned the emerging investigators. Those are folks who are just starting their career. A lot of them either in the lab or doing clinical science or behavioral science, and they're trying to get their footing. And these large meetings can be overwhelming, but they're exciting, but they're also overwhelming. And I think the focus that CROI has had historically on creating special tracks for the emerging investigators has been a really extra special part of the meeting. Can you talk a little bit about what you guys do for the early stage investigators?
Yes, would be very happy to do so. So before our opening session on Sunday, we have a young investigator workshop. Now, this is named for Scott Hammer, a physician researcher who prematurely died, who you and I both knew, in honor of him and his commitment to young investigators. So at this young investigator workshop, the young investigators get to have a series of talks by experts in the field that give overviews and what they can expect to see at CROI. And it's very interactive. People can ask questions, and it kind of gets the energy going. Then when these are followed by some special sessions in the afternoon are geared to young investigators, but also really everyone. Workshops on, for example, laboratory techniques, clinical trial design, which can be very important. And then we also have the fun sessions that you and I as clinicians like, ART cases and hepatitis cases, which also bring energy to the room. During the course of the meeting, we have special sessions at lunch where young investigators can sign up and have lunch and talk to some of the plenary speakers. And I've attended and observed a couple of these, and they're amazing because the plenary speakers can talk about their story, their obstacles, the doubts that they had, and the excitement they had from their career journey. And also the young investigators get to meet each other, and they're from all around the world, and they can kind of take notes. And it's a phenomenal networking opportunity for the young investigators. The young investigators are such an important focus for us at CROI. They're our future. And honestly, Mike, this year, it could never be more important. With all the challenges that everyone is facing in science, in particular, the young investigators at a critical point in our career, we are all committed to supporting them.
Yeah, absolutely. You mentioned also, it really is pretty special how generous a lot of I think almost all the investigators, at least that I know in the field of HIV medicine and in virology, are extremely generous with their time and energy, especially for emerging investigators. And you guys do such a great job of finding the right people to present at that session on Sunday. So I've seen it where immediately after a talk, several of the audience members will make a beeline to the presenter, and they just are able to meet the person, but also ask questions directly. And it creates a really exciting dynamic environment that is so supportive of early investigators.
And I have to say, our young investigators themselves bring energy to everybody in the meeting, which, it's a two-way street. And we all appreciate. I don't know if you saw when in one of the workshops, when a person answered a question, they threw something out into the audience. It was like a little, I can't remember what it was.
Lobster or something.
Yes. And I thought, that's great. That speaks to people, that's great.
So obviously our time is going quickly as I knew it would. Let's take a little bit of a dive into what we can expect to see coming out of this year's meeting that you think is particularly exciting or we should keep an eye on.
Well, I think, what are the kind of the hot topics in HIV right now? Cure it has and always will be a hot topic. We're still in the single digits of cure cases, but everyone is important. Lots of different approaches are going to be being used, monoclonal antibodies, and there actually is going to be a plenary about that. Treatment, oh my gosh, think about how it's evolved over the years, Mike. We've gone from, 20 pills a day to a single pill. And now we have injectables that can be given on an infrequent basis. And we're going to hear a lot more. We're so thrilled that there's still investment and development on new agents and these long-acting agents. Exciting data on STI prevention with DoxyPEP. And, one of the areas, Mike, from us, we've gone with concern of underweight to overweight. One of the plenaries I'm really looking forward to is the plenary on how we do weight management. We know this has been a revolutionary advancement for, people with and without HIV of these weight loss drugs and how they improve heart and kidney function. And so I think a lot of us are really looking forward to that. Drug resistance is still important. It's not front and center as much as it used to be. That's a few, but we definitely need to keep tracking it. And previously we were just talking about survival with HIV. Now we're talking about aging. And this
Yeah.
is such a reflection of the success of CROI. And, I would be remiss if I didn't talk about the important role that the pediatric component of HIV plays. The, for for lots of logistical reasons, drug development pediatric always lags behind adults, and the kids are smaller, the choices are smaller. And the statistic that always speaks to me is that, although children are 4% of the persons living with HIV, they represent 13% of the deaths. This is so unacceptable, but we're starting to see more rapid development of the drugs we have for adults being available for younger and younger in ages. Specifically, I'm talking about integrase inhibitors.
Yeah. And the long-acting agents will be game changers for young people, I would guess.
Absolutely. We already have data about adolescents, which we know how adolescents do everything we say. That was a sarcastic statement. So it really helps with that.
So a lot of people will be attending. I know it'll be at least 3,000, maybe up to 4,000 making it to San Francisco for the meeting. But that means a lot of people can't attend the meeting. I know there's a virtual component, but for those who are not signed up for the meeting, what's your recommendation for how they can kind of keep up with things and at some point access the information that's presented at CROI?
Great. Thanks for that question, Mike. So right now, after a oral presentation is made, it is released on the website to the public. So that is one way to get information. Second way is the entire program is released to the public 30 days after the meeting. In addition, there are many follow-up meetings. I'm sure you probably do some of those. We do them in San Francisco. The community does them, of what happened at CROI. What does this mean for our practice in the basic science community? What were the hot things that happened? What's up and coming? So there is a lot of follow-up from CROI, and then IAS-USA also puts out a special issue with overviews of the highlights of the meeting according to the various topical areas.
Yeah, and the IAS-USA is the secretariat for the meeting and helps organize it. So it's a really easy transition from content presented at the meeting to delivery of the summaries of those meetings with the same organization. They really do a great job. And by the way, they are also the sponsor of this podcast. So there's a lot of things that they do. So lots of exciting things going on. A lot of work that I know you've put into personally, but also the leadership of the meeting. Thank you for all you've done. And any final words before we wrap up?
That we as a scientific community need to stay together during this very, very challenging time. We really are acknowledging all the hardships that the communities that we serve, that the people are working in these communities are serving together. What we can do for our advocacy is to present and discuss the best science at this meeting and make sure that the information that we're generating is getting out to meet our overall mission to improve lives of people living with HIV and at risk for HIV.
Yeah, and I think just to put a little bit more uh, depth into what you just said, I think part of what you're describing is some of the confusion at HHS and at the NIH and other and CDC about what travel will be allowed and what wouldn't. And I know that for a couple of weeks there at the beginning of February, it wasn't clear whether any of the scientists from NIH could attend. Now we've heard just this week that they will be able to travel to the meeting, and that's good for everyone.
Yeah, and thanks, Mike, for saying that. IAS-USA has done a tremendous job on our home webpage, updating researchers from these organizations that are being affected, so that we all know what's happening, and we have done everything we possibly can to accommodate all the presentations that were submitted. People were concerned, are a lot of these presentations going to be withdrawn for CROI? And I know the latest was that over 97% of everything that was accepted is going to be presented. And that is a tribute to IAS-USA, all the investigators that have done everything they can to share their science.
And the leadership of the meeting as well, including you. Well, I'm really looking forward to being there again this year. Nothing else to see what kind of backpack we get. And It's, it's a very exciting time for all of us. Thanks for all you do, Diane. It's been a great conversation today, and I know we're all looking forward to the meeting.
Thanks, Mike. My pleasure. And looking forward to see you in my hometown of San Francisco in March.
We will be there. Thanks, Diane.
Thank you.
Thank you for listening to this episode of Going Antiviral. Catch up on earlier episodes wherever you listen to podcasts, and check out the video versions of this episode and others on the IAS-USA YouTube channel. You can find these links in the show notes, or simply go to YouTube and search for IAS-USA, and there they are. Be sure to subscribe, rate, and review Going Antiviral on Apple Podcasts. This podcast is for informational and educational purposes only and is not intended to serve as medical advice. Opinions expressed in this podcast do not necessarily reflect the opinions of the IAS-USA or its affiliates. If you have a question you'd like answered on the show, you can send it to podcast@iasusa.org to be answered in a future episode.